bonjour à tous et bienvenue dans cette 8e édition de la conférence annuelle de l'Observatoire de la...
Welcome again to the second part about the gender inequalities in the live from Fondation Pierre Fabre in Lavore near Toulouse and broadcasted everywhere in the world in French and English. More than 500 people were following us this morning live for this conference, plus the campus that were open everywhere: Egypt, Cameroon, Ivory Coast, Madagascar, Bordeaux in France, in Laos, Thailand, Lomé also, in Togo. So thank you very much to all and everyone because you were watching us live. And please send your questions. We had lots of hello, also a little message. I think it's very nice. It's a sunshine from southern countries in this winter of the north. And so we carry on, go back to the south, so carry on thinking about digital uses to reduce gender inequalities, because digital could be leverage, really something to empower, a tool to empower people, to act. How can digital tools can help us and can really embark whole communities towards more power and autonomy for women. We have Nelly Munyasia, who is executive director of Network Kenya, a network that is representative in Kenya. And please welcome us.
Kenya pour participer à cette conférence aujourd'hui. Assiatou Niang de l'ONG Speak Up Africa au Sénégal, voilà, qu'on peut applaudir également. C'est une ONG qui prend la parole. On verra avec vous sur des grands thèmes de société. Vous créez des liens entre les acteurs politiques, associatifs ou autres. Et vous allez nous parler d'ici quelques minutes de votre tout nouveau programme de mentorat, notamment pour les femmes africaines dans le domaine de la santé numérique. Nusura, Myonga, voilà, va nous rejoindre également. Vous venez aussi de loin, puisque vous avez fait le déplacement de la Tanzanie. Vous êtes chef de projet dans l'ONG Initiative. C'est une ONG qui est montée par des femmes au service des femmes et des jeunes filles pour leur donner plus d'autonomie avec le soutien entre autres des outils digitaux. Et puis enfin en duplex.
To give them more autonomy, and then in duplex with Malaysia too, Alexandra Tyers-Chowdhury. Chowdhury, you've been working, Tyers-Chowdhury, been working for a very long time in Bangladesh, you're an expert on sex equality and digital gap at UNICEF. So Nelly, so we have these NGOs coming from Africa, Nelly, Munyasia, Alexandra Tyers-Chowdhury, duplex, Assiatou, Niang, and Nusura, Myonga. So if you should be able to make your own choices in terms of reproduction in social environment that is quite poor or rural. So before we use digital tools, before telling us why you should do so, why is it so important for you to give information? It's important to give information. Why is it so important to inform people in Kenya?
But
yes, I'll summarize again. Very simply, we insist a lot on information of young ladies and women in general since this morning. Why, for you in Kenya, is it so important, this challenge of information?
And really excited to be part of this very, very rich conversation, especially around digital health. I work for an organization that works to reduce sexual reproductive maternal morbidities and mortalities, and more importantly among adolescent girls and young women. And why is information important? For the longest time, access to information has been a greatest problem because of social media myths and misconceptions where ordinarily adolescent girls and young women are not allowed to access information around sexual health. And this is because the men have the power and they believe that, for example, if a woman is to get married, a young girl is to get married, then this means that it's the man that should be providing this information. A lot of this information has also been there's a whole issue around this information being from the North and being a white agenda, and therefore not being contextualized to our context, where we see young girls getting pregnant at a very early age because they do not have the information in terms of where to access services, for example, contraceptives if they need, if they are pregnant, where to access safe motherhood services. And then also the issue around disinformation, a lot of disinformation in this era of digital platforms. There is where, for example, manufacturers want to market their products, so therefore they'll be giving the wrong information or information only limited to the benefits of their products, which might not be very important. And the whole issue also around opposition. I don't know if in countries where you come from, in the Global South, we are experiencing a lot of anti-gender groups that, are trying to impose on us what they're calling family value-based approaches to SRHR, where they're forcing, they are preaching the gospel of abstinence, and that is something that doesn't happen in Africa. Poverty indicators are very high. Young girls find themselves getting married because they're coming from homes that are young, child-headed, or they're living with grandmothers who are bedridden and they're not able to afford $1 a day. At the end of the day, they end up engaging in transactional sex, and so really abstinence then becomes a problem because they have to engage in whatever business for them to earn a living. I'll stop there.
On va voir d'ailleurs quelques images du Kenya. C'est toujours important de se projeter.
We're going to see some images from Kenya. It's very important to see. You can see that in this NGO for training. We have lots of taboo issues and topics within the women's community. Can you tell us taboo subjects and stigma that there can be around those subjects too?
And that video particular is a documentary that we did recently of a facility that we opened in one of the very, very rural areas and hard to reach areas. And this is a pastoralist community who majorly their role is to take care of their cows. In this community, young girls as young as the age of 9, 10, 11, 12 are forced into what we call female genital cutting. And this is some sort of transitioning from childhood to adulthood. So what are we saying? We see a lot of child marriage. And this is also because of the social norms. Then they get married at 12, 13 years old. And then the husband continues to get more wives, because again, traditionally a woman is supposed to be used to earn the homestead cows. So when you're married off at the age of 12, 13, then you're exchanged you're exchanged for cows. And we also see, of course, polygamy becoming a norm where it is allowed, and we see young girls becoming, you're young, but you have several co-wives. And this also predisposes them to HIV, because again, young girls do not have, or the adolescent girls and young women do not have the power or the agency to negotiate for safe sex. What does this transmit to? To an increase in HIV transmission. And all this is connected to the social norms around the community, our culture where men still have the power, where young girls are sold off so that the boy can be taken to school and given, education, because then they're considered as, they're considered as being very powerful and being the heads of the home. Then that means that every positive thing then has to be attributed to them.
Ouais, et pour compléter ce que vous disiez, notamment au niveau de
And to complete what you were saying about the need to inform, we often forget it is a taboo subject, but Africa is really the continent where the epidemic is propagating, and the first victims are often women. It's women who are victims of HIV. So we could see in the images you are doing lots of viral videos of information about sexuality, but also to fight against disinformation. What kind of video are you have you produced? For what kind of false information that was broadcasted on the social networks?
We use various forms of addressing the myths and misconception that comes with this information. And we have a huge following on Facebook. If you've clicked Reproductive Health Network Kenya or Nena na Binti Hotline, which is our call center, we have a huge following. And we use that because, one, when I say that access to contraceptives, for example, is considered a northern agenda and not an African agenda. And so we want to provide information that population issue, demographic issue continue to be a very important conversation in Africa, and contraceptive is the only, approach or the only way that we are going to improve even our poverty indicators in our country. We also use Instagram, where we are targeting adolescent girls and young women. Like I mentioned earlier on, health-seeking behaviors of adolescent girls is quite different. They do not want to walk into facilities where they'll meet their aunts or people age mates of their parents, and therefore we are very intentional in using social media platforms where young people are comfortable at the middle of the night, where they would wake up and find the right information when it comes to sexual reproductive health. And also we are currently using TikTok, and TikTok is a big thing in the global south. We are seeing influencers that are young people, and what we've done as an organization is also build the capacity of those young influencers so that whatever content they're putting on their TikTok medias, then it's information that is it is useful information and helpful information to the young people. Then finally, we also run a call center called Nena na Binti, loosely translated, speak to an aunt. An aunt is a very important person in the global south. And therefore, we have a trained nurse counselor for about 5-6 of them, who manage the call center, and they provide right information, provide a safe space where young people can call in, speak to a counselor, and also provide information. And Kenya was able to be among the leading countries that domesticated the WHO 2019 reproductive health guidelines last year. And it is very broad. It is allowed for telehealth, has allowed for self-managed abortion. I know in Kenya, abortion is a bit restricted, but it gives the power to the healthcare providers. And so there is the grounds that have been broadened to allow for self-managed abortion, self-injection, HIV self-testing, and this allows for autonomy and choice. And we are using our call center that is also attached to a digital platform to provide information and refer to healthcare providers. Finally, in all this, we are centering healthcare providers at the center of all this conversation because they remain very critical and important element of the ecosystem. In case of any complications, then the healthcare provider, nurse, midwife, doctor, gynecologist remain very critical to ensure that they provide the relevant information and service. Thank you.
Passionnant parce que vous nous dites d'abord énormément de choses qui viennent du terrain, de votre expérience.
Yes, you're telling us a very important thing from the field, from the terrain. You are really, you have platforms that exist. You don't need to exist new tools. That very important platforms that are there, and you use them fully. Facebook, Instagram, TikTok. Lots of videos also that are on the WhatsApp. You have your own platform. You complete with a call center. You can see the digital strategy is really strong and massive, so that you can really have an effect on young populations. Throughout those social networks, do you see movements for changing the communities? When you send a message, well, through Instagram, let's say, or TikTok, you don't just touch one person. Touch one person, you can spread it around and share it with his or her circle of friends and family. So does it make mentalities and mindsets, do they evolve quickly then?
Of course, advocacy is not something you expect results tomorrow, but we are seeing a lot of, change in social norms. We are seeing a lot of change in attitude. We are seeing young people becoming more bolder and even asking for these services. And because what we do using our social media platforms and our digital platforms is, for example, provide information in terms of the legal framework when it comes to something like abortion, which is, usually very problematic, and just trying to let them understand what does the law of Kenya do, and therefore they are able to hold the government accountable and tell them, we know very well our constitution says this and we are demanding for these services. For healthcare providers, then we also see the attitude change, and we see in terms of how they even provide services to adolescent girls and young women in their diversities. And I insist on in their diversities because we have the trans population, people that identify themselves otherwise, that are also in need of these services. And a lot of times, these are conversations, again, in the Global South that are not being allowed. However, as a healthcare provider, then you need to know that your role is to provide services without judging. So using our social media platform, we see the change in attitude of healthcare providers, and also just getting the communities, creating an enabling environment for the young people that are in need of these services to access the services, and also the providers that are providing these services to be bold enough to provide these services. So we see the change.
Et on voit quelle est la force, la puissance de ces médias pour amener.
And one can see the power of those media to bring new ideas in communities, and communities are changing and a lot quicker. Just a last question, because you have lots of feedback from the field, from thousands of people. What are the topics, the questions that are more frequently asked on your different platforms?
Number one, is abortion legal in Kenya? And I think that one, if you went to any of our social media platform, you'll see that. And then number two, of course, the myths and misconceptions they keep on hearing when it comes to contraceptives, those are the most frequently asked questions. And you'll hear men saying, will my wife become, or will my partner be able to get children if they used contraceptives? And this is because of the myths and misconceptions that they get to hear. Then also the issue around sexuality education, they ask, aren't we sexualizing the young, the young children? So we are able to provide the right information when it comes to that. Yeah.
On voit avec vous l'importance.
One can see the importance of this digital strategy that is really well targeted, well identified, and they use this massively social network. And this morning we heard the importance to adapt messages to the people you had in front of you, and this is what you are working on, Alexandra Tyers-Chowdhury. You're with us live from Malaysia. So, of course, I'm going to ask you, what weather do you have there in Malaysia today?
Very hot. Oh, that's a very big thunderstorm at the...
Ça fait toujours rêver. Je suis désolé.
It makes us dream. We're going to speak with you, Alexandra. We'll talk about an application that you worked on, that is called Odess. It is an application that is developed by UNICEF for young women towards all the questions that they might wonder about their menstruation. First question, why did you use a digital tool, an application on that topic?
Fantastic question. Echoing what my panelists said earlier, we knew that girls had lots of questions about menstruation and puberty and sexual and reproductive health, and they're increasingly going online to find this information, but there's a lot of disinformation out there. A lot of this kind of information, or the questions they have, they're quite private. Girls wanted something where they could ask them discreetly and they could get answers very quickly in the tools they used every day. So we spent, many months working with girls, co-creating with girls, primarily in Asia, which is where we first developed the tool, although it's spread across 14 countries across sub-Saharan Africa and Asia. But in Asia, we spent months talking to girls about how they get their information, how they wanted their information, and also trying to understand if there was a role for digital. And based on what girls told us and based on what they came up when they designed, that's how we came up with this digital tool.
Et avec une spécialité.
One specificity, this application, you don't see a GP, a nurse or a physician that will give you advice. It is like an older sister that will give advice to the younger sister. Why?
Great question. So the way the app has been developed, we use an avatar, which takes the form of an older sister. And when we spoke to girls, and we see this in every new market that we build Oki in, girls tell us that the kind of information they want and the questions they have are much more comfortable talking to an older sister figure because they feel they can ask broader questions at things they might be a little bit embarrassed about. So that was why we designed it like that. The girls told us that's what they wanted. We don't use like connections to doctors or to nurses for two reasons. One, for privacy. Privacy is a very big part of this application. We don't have anything like geolocation. We don't have anything that can identify the girls, but also connectivity. The app works completely offline. Girls don't need the internet to use it. The moment you link to a doctor or a nurse or a service, then you need the internet. And talking about digital health and gender, there's a very big gender digital divide for women and girls. Women and girls have much less access to internet and mobile phones broadly, but much more prevalent in parts of South Asia and say like West Africa. And so that's one of the reasons why we've built the app that way.
Et c'est une application pour vraiment voir à quoi elle ressemble.
It is an application we're going to discover now in a short video.
Aki, a period tracker app for girls like you. My name is Ari. Use Aki to get to know you by tracking what's going on with your body and mood every month and learn about periods in fun ways. Create an account and choose an Aki friend like me to accompany you. We are here for you every step of the way. This is your monthly menstruation cycle. Each shape is a day of the month. And this number is your personal countdown. It shows how many days until your next period or how many days left of your current period. Track your mood, period flow, body, and activities with emojis on the daily cards. Write in your private diary card. Test your knowledge and take fun quizzes. Check out your calendar and see your whole month at a glance. And check out the Aki menstruation and puberty information to learn new things about your body and health. And don't forget to send me some love. Welcome, friend, to Aki. For girls, by girls, period.
Voilà, c'était important.
It was very important. We can really give them a big round of applause because it is a wonderful application. And it was nice to see because it's such a huge change. It's not just a medical information. It's designed by young girls. We are in aesthetics with young girls, with avatars that each one is going to choose according to her skin color. It is an adapted language. It is like a video game, environment with applications, with everything that young people do today. This application was developed by UNICEF. It is open sourced. So does it mean that anyone can adapt it to anywhere, to anything in any country?
Yeah, what you saw there on the video is the global English version, but in the 14 countries where Oki is live, it's in each language that the girls choose. So Oki South Africa is in 7 different languages. Oki Kenya is in 2 languages. Oki Ukraine is in 3 languages. And as you said, girls, they design it in each country and then they choose the avatars. They design the avatars to them. So Oki is open source, which means that the code and the content and the brand was developed by UNICEF. But what we do is we give a license to one organization in each country who then takes on the responsibility, the franchise, if you like, to build Oki and be responsible for it and take ownership. So UNICEF were the beginners, but really it's now in the hands of other organizations across the countries.
Alexandra, vous avez...
Alexandra, beyond your contribution to Oki, you have also co-drafted a report for UNICEF. This says, what do we know about a digital gap on gender? We're not going to have that much time, but in a few words, what do we know about this digital gap?
The answer is very little. We know that there's a digital gender gap for women over the age of 18. We know quite a lot from people like the ITU, the GSMA, and mobile operators. But for girls under the age of 18, we don't know that much. And this is actually a problem because this is a new generation. We need to start looking downstream as these girls grow up and they want access to information. They want access to services in a digital economy. If we don't know what technology they have and they don't have, and why not? My previous panelists mentioned social norms. That's a massive issue. We cannot design digital health platforms to reach girls. So that is a very big issue. I think we need to address the evidence gap.
Et toujours.
And again, keeping in mind the challenge, because we don't know that much of those young girls who are less than 18, to have access to a mobile phone or to internet. That is a real challenge and is not that obvious. And in social norms, it is not accepted everywhere. We should remember that.
Vous me citiez... Yes, pardon. Allez-y.
Yes, go ahead.
No, I was just agreeing with you, Lionel.
Vous me citiez effectivement beaucoup d'exemples en préparant cette conférence.
Yes, you were quoting many examples of countries, but often the father, the brother, the husband doesn't allow a young lady to look at a screen on her own. And if you don't take that point, we can't really go forward with the digital help. Digital tool.
That's right. Worked a lot in Bangladesh. I think Bangladesh is a very good example of very strong gender norms about adolescents and adolescent girls in particular, and kind of a lot of fears of the negative side of digital rather than the positive sides for adolescent girls. So fears that, daughters might be approached by strangers on social media, fears that they might be doing things that are seen as like wrong in society. And so this often keeps girls offline from gatekeepers, so to speak, parents, mothers-in-law, other members of the community.
Assiatou, depuis Dakar, quel regard sur cette application que l'on vient?
Assiatou, what is your outlook? What is your opinion about this application from Dakar? I think it is really relevant and it is put back into context because we can see that in many other countries, in many languages, and it is exactly an example of something that is an innovation within a context, and then a context, and then it can target population and really contextualize application. It's a very important idea. In 2022, your NGO Speak Up Africa launched with the African Union the Initiative for Women in Digital Health to make sure that women's health will be really well taken into account at all levels. Women who are very in rural areas, who are very far away from any health center. What kind of digital tools it could add for those people? The initiative is called A8, African Women in Digital Health. And the initiative is to bridge the gap between the gender gap. And really the initiative aims at promoting the whole participation of women and leadership of women within e-health. And this initiative highlights new ideas, entrepreneurs in the digital world who create innovations that are extremely relevant for the needs of their own community. therefore, those innovation people are creating digital solutions based on what they went through and what they had observed in their community, and they position themselves as activists and within their community, bringing the solution to the girls. It is a huge point of view because it's Pick Up Africa. You say you need to boost women, entrepreneur women. They need to take ownership of this and find and propose solutions themselves, so that they are. You've just created a mentorship program for entrepreneur women in e-health sector. What is it about? Well, it's a whole new program that was launched in July of this year, and it is a program it is a capacity building program, because here capacity building is a big pillar. So it is a capacity building program, as I was saying, and the aim is to identify mentors, women who are leaders in e-health, in digital health, and 5 have been identified. It was a bid for, it was a call for tender for young women who are innovating and who want to have access to leading jobs, so that they send their own CV, and they're very inspiring personalities, women who have succeeded. But very concretely, what are you going to propose to them? How is it to work? On what time schedule? Well, at the end of the month, we're going to have a boot camp in Kigali for 3 days. And the mentors and the mentees are going to meet, so to do capacity building around strategic communication, because even if we know that communication is really paramount for innovation, to explain what you do, many women do not have the trust or the tool to be able to present their innovation, to attract investors and partners, but also to boost an interest from different communities that will use this digital solution. We'll have 3 modules: strategic communication, leadership, marketing too, and product development. Because for MedTech, for health technologies and medical technologies, there are a few hurdles according to countries. You have countries where you need licenses, you need tests, etc. So you need to have them concretely to know what you should do before you can really launch yourself and before you can commercialize this. And you're saying it is important to have women who are innovating and proposing new solutions, because innovation for you, it's better perceived by a woman if it is designed and conceived by a woman. Absolutely. When Alexandra she's going to talk about it, but you have many topics in sub-Saharan Africa that are really taboo. Everything that is health, sexual health, and menstrual hygiene, and reproductive health. And maternity. They are women topics, and when innovation comes from a woman who would better understand challenges that come from those issues, the consumer, the users of this innovation, they are in confidence because they feel that this lady comes from our community, she understands our challenges, and on top of that, innovation is going to really address those specific points that are identified as real needs. So you're really moving the lines, you are boosting women to go forward, empowering them, you giving them the tools through the mentorship to go further in their innovation. You can feel this energy. Can you see also all the ministry, the Directorate of Health Services, they're often hospitals, they're often men. Do you think they're going to move with you? In a conversation I was having with a lady earlier, I was telling her that nowadays things start changing, because we are really aware now of the need to have women in these leadership jobs. And we're trying to work with African governments to be able to integrate gender perspective in public policies. It means that you can boost investment for women entrepreneurship, for digital tools and digital businesses, so that they can create the solutions for women and for the women by women, because financing in sub-Saharan Africa, and only 3% of financial help goes towards women startups. So there's lots of way to progress.
Initiative en Tanzanie.
In Tanzania, your organization does a lot for women. In 1 or 2 sentences, can you summarize what you are doing? Could you summarize what you are doing in 1 or 2 sentences? Because we know you are doing a lot.
For the opportunity. So we are her initiative. We are a non-profit committed to break the first of all, society norms for young girls and adolescent girls, especially in Tanzania. We have different interventions to make sure this, the norms are broken down. We have combining 2 ways, both economic empowerment and digital integration, together with to make sure these young women get access to sexual reproductive health education. So we are doing a lot of different things, but in summary, that's what we do.
Et vous aussi, vous avez...
And you too, you launched a mentoring program called Going Beyond, mainly for young girls. Could you tell us a bit more about this program?
So one of the programs that we currently have in our organization is called the Going Beyond program. This is a program for young entrepreneurs, 70% of it being young women. The biggest goal is to help these young entrepreneurs using a peer-to-peer model to reach a greater market, to move their businesses from the traditional businesses to now digital businesses, because we believe there's so much opportunities in there. We're not telling them to move away from traditional. We're telling them there's also an opportunity for you to touch that market too. So that's in general what we do. We use peer facilitators. So we bring a group of young girls and boys, 70% of it being young women. So we provide them with the education, with the resources, with the help from the Mastercard Foundation and Digital Opportunity Trust. We empower these, we call them youth leaders. These are facilitators now. And then after we've taught them, they go now to their communities and meet more young women and men, share the information from us that they got during the training of trainers. So yes.
Et justement, parce que c'est aussi...
Well, this is the theme of this e-health seminar, to develop this program and the information to young girls in Tanzania. What are the digital tools that you use and how do you use them?
So we also have, as one of our intervention, this happened after COVID. So we we opened first Swahili e-learning platform. It's called Panda Digital. So when you go to Chrome or any browser, you search Panda Digital, you get access to it. Unfortunately, it's in Swahili because it was designed for young women in Tanzania. So we're very proud of that, because there's not a lot of resources that are in Swahili that our people understand. So we thought that would be a great opportunity for them to come and learn using the platform. So in the platform, there's a lot of sections. There's a lot of things that we offer. But one of the most important things that we offer is called Ongea Hub. Ongea is speak. Ongea is a Swahili for speak. So it's a place where young women can come and report any cases of sexual harassment or sexual corruption that happens when they're doing their businesses. They also, sometimes they just don't have anywhere, somebody to talk to about maybe their mental health, maybe, what is going on with them because of the society norms, because of like the cultural backgrounds in our communities. So the hub helps them to, be connected with experts who will help them, who will talk to them and help them, and eventually connect them if there are cases where we have to connect them to like maybe courts, so we link them with a specialist that will assist them and help solve their problems. I wanted to add that on top of the e-learning platform that we have, that you can offer, we also have the SMS platform, because we believe not everybody has access to the internet, and the e-learning platform for now is reached when you are connected to the internet or bundle. So we have the e-learning platform. We use AI SMSing. So we have a special number. This is to reach people in rural areas, because we believe there's a lot of young women facing these challenges in rural areas, and they do not have these phones that has access to, internet where they can go and browse things. So there's a number, they send, they register themselves, they ask the questions. There's a lot of opportunities. There's a lot of things that they can do. But yeah, you choose what you want, what service you want, and then the SMSing helps you with that.
J'ai une question pour vous quatre au fur et à mesure que je vous ai.
I have a question for the four of you as I am listening to you. This is a place here where we talk about e-health. We are very technical sometimes. We talk about innovations to do remote echographs, remote CT scans, very complex medical examinations. But I've been hearing some words this morning, such as information and choice for young girls about what they can do with their own body in the way they want, with their sexuality, with their reproduction potential. Is it my perception, or are we observing a change in needs? Is it true that needs are becoming less technical and more societal?
Yeah.
I think there is a lot of social and cultural factors linked to health. And today, in sub-Saharan Africa at least, women have a new freedom, a new understanding that they didn't have in the previous generations. So with some social and cultural hurdles, such as early marriage, which is quite widespread in sub-Saharan Africa, women realize now that they do have a choice, that they have the right not to get married early just because society tells them to, or they may decide not to get married early or not to have children early, and women make the choice. They can decide on what contraceptive to use, and they follow training courses a lot more than they did in previous generation, because that was taboo. There was no information around these subjects. So the fact that they have more choice now, and the fact that they are more aware of their freedoms, gives the possibility to women of making health choices. I turn to Alexandra. You are in Asia. We've talked about the example of sub-Saharan Africa. In Asia, do you have the same challenges? Is there this strong need for information and choice for the girls about what they are going to do with their bodies?
I think it's I think we're asking, right? That question about needs, we are learning that to truly design an inclusive digital platform for girls that they want and need, we're actually asking them about what they need. And so your examples of how we've traditionally thought about e-health, I think that's where the shift is. Obviously, what fellow panelists said, absolutely. Just thinking about the digital thing, I don't think it's necessarily new. I think we're just asking different questions.
Nelly, je voudrais connaître également votre point de vue sur cette question. Ce sera...
Nelly, could you give us your viewpoint on this? Alors.
Of providing information. Of course, we are advocating for choice because it was one of the gender norms that we're dealing with, because we know that traditionally women did not have a right to choice. The decision was made on their behalf. So really, we are just trying to work on the social norms that traditionally have made it a bit difficult for women to stand up for themselves. And this is something we are doing so that as young as 10, 11, 12, depending with context and where you're coming from, then young women are able to stand up for, to stand up for an informed choice. And like Alexandra has correctly put it, so we are not working alone. We are working with the adolescents themselves. We are working with the youth themselves, so that whatever program we are coming up, whatever innovation we are coming up, they are at the center of it, and they're guiding the process and telling us, this is what we want, this is what we think will work for us. Even in terms of messaging, like I said, the issue in Kenya, you cannot just talk about comprehensive sexuality education. They are telling us innovatively say reproductive health, innovatively say age appropriate, because the kind of content we'll give a 9-year-old is not the content we're going to give a 15-year-old.
Ouais, on voit comment dans ce monde de plus en plus globalisé, les réseaux sociaux amènent.
Now, social media lead to massive changes on all continents. Thank you for the four of you, and remain here with us, because there will be questions to you from the room and from the internet as well. Before we have a session and answer question, let's go to Lomé, to Togo. In Lomé, there is a whole day of reflection on digital health in Togo. And you are attending our Odess conference here in France, Toulouse. Giscard Kofi Sambwe is a coordinator of the Foundation of Pierre Fabre in the country. Can you hear us? Who is with us today, with you today, Giscard? Can you hear me? We can hear you perfectly well. Unfortunately, the sound is not good. There's a lot of echo, we can't hear. We are together with the ministry. With we apologize, the sound was not good. You talked about e-health in Togo. Now, what are the work you're doing at the moment in Togo? I apologize. The interpreter apologizes. We can't hear well. There's too much echo. Interpretation is impossible because of too much echo in the room. This is unintelligible.
Mais également des applications, des sites internet, des ventiles, pour pas dire des formations sur comment gérer les conflits menstruels, sur les questions de santé sexuelle et reproductive, mais pas seulement cela, mais aussi des initiatives qui viennent du ministère de l'économie numérique en matière de la cybersécurité, de la digitalisation, des schémas directeurs pour l'élaboration du plan stratégique national de santé numérique. Voilà, et aujourd'hui, on pose la première pierre pour la construction du Centre national de santé digitale vidéo.
The moderator is probably going to summarize for you, as we cannot interpret this. Sorry. Thank you for this. One last question for you in Lomé. Can you see yourself in what has been said in this panel? Can you recognize what you are doing? And do you have a question for our guest speakers?
Ah oui, c'est comme à Pierre Fabre, comme ici à la Fondation, le micro circule dans l'amphithéâtre de l'Université de Lomé et on va pouvoir entendre.
They're circulating the mic in the amphitheater of the University of Lomé. Let us see if we can hear the question. We work on women and young girls. No, sorry, we apologize. This is not doable. Very sorry.
Qui sont des moteurs donc, de la culture et qui perpétuent les éléments socioculturels. Donc, je vais faire un plaidoyer pour les panélistes, pour ceux et celles qui ont présenté des projets, pour qu'on puisse inclure donc, les champions jeunes hommes et puis dans cette politique de changement, et nous présentons par rapport à...
Alors, je vais reprendre votre...
I am going to summarize your question and ask you, Setou, perhaps, how do you include men, the young generation of men? Because we talk about young women, but how about young men? Do you see any changes in the young men's generation?
Thank you for the question. I think that's a great question. And we get that every time when I speak about working with young girls. So our goal and mission is to work with young girls, but we believe in the communities that we live in, there's also men there. So in all of our approaches, there's, for example, with our Panda Digital, it is designed for by women, for women, but young boys and young men have access to it. If you go there as a young man, you sign in, you log in, it won't log you out. But we are saying this is particularly is for the girls, because there's been a challenge for them to access this information. So we're like, this is for them, and the biggest percentage, there's about 7,000 people who've reached the platform, and 95% of it are young girls. Right. But the men and young boys are there too. In all of our other interventions too, young men are there. For example, the Going Beyond project that we currently do, 30% of it are young men. We believe in the integration of both. So we do involve young men too.
D'autres questions depuis cette salle ici? Voilà, le micro est au fond.
More questions in this room? Yes? Have you found a solution for these to continue existing? Because maintaining active application costs a lot of money. It seems simple to use, but in fact it's very complex. There must be continuous development, and that costs a lot of money. It is complex to publish them as well, to remain present on the platforms. All these are hurdles. Have you got in mind a solution? Because these are not NGOs we're talking about. We're talking about very small structures, very small initiatives, and how can they be supported? This is a very good question. In fact, we've been able to observe that there is a sustainability problem for the existence of these platforms, above all for the small organizations who are in need of funds. And we are promoting now collaboration and strategic partnership to ensure durability. So these women entrepreneurs, we put them in contact with renowned investors who can help them maintain encourage durability, but it is not sufficient. We also work with governments so that these women entrepreneurs can take part in the working group that they have at ministry level to make sure that there's always a link between the innovation that is created and that responds to a specific need at the ministry. And thanks to this, these women entrepreneurs always know about new funds and new opportunities that are available in their sectors. And there are communication channels that are always opened between the Ministry of Health or Digital and these women entrepreneurs. Yes, applications are created, they cost a lot of money to develop, but then every month you have to pay for licenses, maintenance work, and there's always a lot of costs involved.
Thank you. This is a question for all of you, and it's about the intersectionality between gender and disability and neurodiversity. But first, I love the approach of nothing about us without us. Like, all of you are taking that approach, which is hugely commendable. How have you thought about those women or adolescents that are marginalised due to disability, cognitive impairment, or neurodiversity?
Qui est-ce qui peut répondre? Nelly?
Yeah, probably I can go fast. Like I say, our target group is adolescent girls and young women in all their diversities. However, we also take note that working with, especially those with disabilities, takes a lot of investment. And I will talk about our network of providers. Our providers provide services to those with disabilities also, and our facilities have been set up in a way that they are accommodative of whatever disability then the adolescent girls and young women walk in. Our areas of focus, of course, we work in rural communities and peri-urban areas, and this is where you get a lot of this population. And just mentioning that they come with compounding vulnerabilities, disability being part of it. So our way of providing these services is integrating health, sexual reproductive health care. So it's a one-stop shop. You're not coming there for HIV, or you're coming in as a result of rape, and then we are referring you to facility X for HIV, facility Y for no. When you get to a facility, by the time you leave, you've gotten all the services, including referring you to a lawmaker if you're a case of GBV, and also ensuring that there's a lawyer on standby to provide pro bono legal support in case you need to take the case to court. However, disclaimer, this is quite financial intense because the lawyer has to be facilitated. Just the whole process of also just setting up the whole holistic care is also, resource intense. Yeah.
Le temps pour une toute dernière question rapide.
One very last question. Merci.
Nelly, you actually answered a part of it regarding the pro bono legal support, but I wanted to ask you, because Kenya was one of the few countries that came up with the digital health bill last year it was released. Like, how do you actually because it extensively talks about the data governance, and the data that you are talking about is personal sensitive health information. So how do you actually govern that? And then, because having a law is one thing, but then ensuring compliance, because you are actually providing this service. So how do you take care of the security and confidentiality of this sensitive information that is residing, like where does it reside? And how do you take care of that? And then how is it actually taken care by the legislation? Thank you.
Yes, thank you so much. And so just to speak a bit about Kenya having domesticated the WHO 2019 reproductive health guidelines, digital bill is part of it. We have the whole primary health care bill that then allows us to take the services to the community, giving power to community-based distributors, and forgive a lot of jargons that I'm using. The community health promoters are very critical in ensuring that primary health care starts right at the household, and that's where telemedicine and digital health is all anchored to. Talk of consent. Consent continues to be a very big issue in Kenya, and this is because age of consent, according to Constitution, is 18, but we have the Health Act that then allows you to access services, and as a healthcare provider, you come in, you're 15-year-old, you're a young person, you're in need of services. We have a whole adolescent and youth reproductive health bill. Yeah, that I know is being revised, but the government is very clear that even young people, as they come in and they need services, then you as a healthcare provider, you have to make that decision to make sure that you're providing services. At organizational level, we have an ERP system that allows us to protect the client data. And our data, they know that it's only provided to the government and our donors. And where we need consent, especially for photos now, because that's very sensitive, we are getting consent before we provide any information for the clients. Did I summarize?
Merci. J'ai le difficile rôle de gardien du temps.
I have the difficult role of timekeeper. This is absolutely fascinating, these testimony concerning the field. This is fascinating, but we can give you all a round of applause for this magnificent panel.